and I will turn it over to you, Neil.
Well, thanks. Good afternoon. I was about to say good morning, but good afternoon, everyone. You know, this has been an interesting transition in traditional law enforcement services. And law enforcement is being asked to do things that traditionally we've never done before. Enforce health orders like wearing masks in public, or if you're a beach community, not allowing people to sit down on the beach. Ensuring that groups of people are from the same household, that people aren't in restaurants, all sorts of things that we traditionally have never participated in. But I think the challenge has been that every county is different. We certainly have the state government, which is overarching for the entire state, but every county has a health officer. And in fact, LA County, I think, has 3 different health departments, because Pasadena and Long Beach have their own health departments. So each health officer can put out a different health order, which has specifics for every community or every law enforcement agency governed by that health department, essentially, that they have to put into practice. And I think the challenge for law enforcement has been these health orders are ever changing. So what's against the rules today may not be against the rules tomorrow. And how do you explain that to the community effectively and maintain a positive community relationship? You know, we spend years and years establishing our relationship with the community that we serve. And so when things like this happen, we have to figure out how to balance the need for enforcing the health order to ensure the health and safety of our community, but also maintaining that positive relationship with our community. Because if we go out and participate in a scorched the earth type enforcement for these types of health orders, the community never has time to adjust and figure out how to play by the new rules, so to speak. And it's also confusing to the community when certain sectors of the community are allowed to operate and be open and others aren't. It's not only confusing to the community, it's confusing to the people that are involved in those areas of the economy. And I think we all know what we're talking about. So how do we move forward and maintain that positive relationship with the community? That's really what I want to focus on today, and figure out what does it look like for our employees too. How do our law enforcement employees figure out how to bridge that gap and interact with our community members? How has life changed for them? I mean, I never wore a mask when I was working patrol, but now we're asking our officers and deputies to wear N95 masks when they're out in public. It's the right thing to do right now, but it's also, a lot of them work 12-hour shifts, and that can become a challenge in and of itself. We're coming up on summertime where a lot of our communities are really hot outside, and we're going to ask them to be wearing this personal protective equipment, and it's going to take a toll on them. And not only that, I know a lot of us are asking them to work overtime, extensive overtime, to comply with these health orders that we are charged with enforcing. And so even large agencies are going to experience burnout from their employees. And not only that, in the midst of all this, you know, we have another law enforcement issue in the country that's going on right now, and that's only going to make it more difficult for our folks on the street to interact with the community, because you know, the media will push this issue we're currently experiencing for as long as you get clicks and views. And so that's going to just perpetuate a lot of the things that our officers are dealing with. So I also want to talk about employee wellness, because we have to keep our folks well to provide the service to the community. So these are all important things, and I don't want to talk too much because it's a limited time. I want to get right into the questions. And if there's questions from the viewers, they can just text them in, correct, Carol? That's a yes.
Go ahead and use the chat button, yeah.
Okay, very good. You'll keep me up to date on that, because I'm not a Zoom expert, correct?
Yes, I will.
Perfect, okay. Okay, so let's get into some questions for our panelists. So the first question is, effective community policing models require face-to-face interaction with the community. How has the avoidance of public interaction impacted the ability for law enforcement to engage with the community? What has worked best for your department? And I wanted to throw this one out to Matt first.
Yeah, thanks, Neil. Excellent question. as everybody knows, that law enforcement's relationship with the community is what keeps us going. It keeps us moving in a positive direction. And you take away that relationship, that communication layer, and things get difficult. Quite often, we're thrust into situations where the community doesn't understand something, and when we get on scene or we grab something by the horns and we run with it, we're able to provide a layer of education to the community, and oftentimes we get resolve in just showing up and speaking with the community. So you take that away, and instantaneously there's friction, there's frustration with the community, and complaints don't get handled on a regular basis. If you stay in contact and try and continue that relationship, work on the building, I think we have the greatest impact at continuing to serve our community. We continuously, I'm seeing increases in community complaints that are very, very small. You talked about masks and wearing masks, and I'm getting 4 or 5 of these complaints on a regular basis daily coming in, to where if we were out in front of somebody and being able to have that face-to-face communication, we're able to triage that and get it down to the lowest level and have an impact, versus it getting pushed from one department to the next. And we all know what happens when that occurs, is the problem manifests, and what started with an issue at the lowest level and no other influences, now it just got ratcheted up to something that it never needed to get to. So that's one of the problems that we're seeing right now in law enforcement, is that face-to-face interaction is missing. What we've done is tried to stay in touch with the community through our social media, through still getting out in the community in smaller type settings, and try and answer those questions, try and be the face of the community as best as we can, while we're maintaining that physical distancing and wearing our masks, and just being out there and being part of the community, not forgetting that the community is out there. I think when we close that door to the station and we don't let anybody in, that's when things are going to get worse. And we just have to maintain, we got to get creative and find different ways of communicating with the public. Memorial Day event over the last weekend, almost every one of them closed down. We saw an opportunity to work with our public cable television and put something live on Facebook. A very, very small event, one speaker and a couple girls singing the national anthem, and then a mother placing the wreath on a memorial. And we live streamed it, and then afterwards we made it available for the public. So another layer, another way of communicating with the public, just staying in touch with them.
I think that's a great point about shutting the front door of the station. You know, we've shuttered our station for 10 weeks now, and you really are putting up a barrier between the community and yourselves. And I think that's great out of the box thinking on the live streaming. You know, when you were talking, I was just thinking, I was down at our beach area yesterday checking on the beach, and I'm wearing a face mask, and we've taken away a lot of the nonverbal cues that we give people. You know, I smiled at somebody and realized they can't see me smiling at them because I have a mask on, and that takes a large part of our communication ability away. It's unfortunate, but that's another barrier there is with officers right now. This is the nonverbal communication cues we give folks. And I think we're all still doing it because it's a natural thing to do, but whoever you're giving that cue to is not recognizing it. So I really appreciate that input. I'm going to jump into the next question here. The pandemic coupled with zero bail impacted the ability to effectively police. What experiences did your agency have with repeat offenders who we were forced to be released, and that's not how we would have handled it in the past? I want to throw that one out to Kevin. You got to unmute, Kevin. There you go.
Better?
Perfect.
All right. Our county as a whole has run into some issues. I know for our agency specifically, as of May, since the beginning of the pandemic, we've had to cite and release over 47 people for drug-related offenses, theft, robbery, things like that. Some of them have been multiple suspects we've had to deal with. One of the undersheriff put out an article recently bemoaning some of the issues they faced. They ended up having a suspect with 145 pounds of fentanyl that they had to cite and release because of the current bail procedures. So it's been challenging because I think it's definitely demonstrated that some of these folks realize there's not going to be consequence, and they go out and engage in the exact same behavior almost immediately. The city of Escondido had a violent assault upon a suspect about 2 weeks ago, and it had been his fourth arrest, and it was from robbery and physical assault, and then ultimately attempted homicide of a transient with a knife. And it's challenging to have these folks. There's no recourse. We can't even begin the steps to help people or push them into some other, whether it be rehabilitation or any other option, because it's taken away from us. There's not even for lack of a better period, like a penalty box where we can assess and how to address it. They're in, out, and that's even if we try to book them in and they get released for zero bail. Most of the offenses now in our county are cite and release, and the officers know that, and it's very challenging to try to be proactively policing and protecting our community, knowing that some of these folks that have no regard for people's property or possessions are going to be back out doing the same thing, and we're going to be trying to address it again, doing the same thing and probably seeing the same response. It's been very challenging for us down here in our county as well. I'm sure it's the same everywhere.
Thanks, Kevin. So I know that it's creating frustration amongst the officers out in the field doing the work and the deputies, and rightfully so. I mean, when you arrest somebody with over 100 pounds of a dangerous drug and there's no consequence for that, it becomes a difficult message, because we all know that drug kills people, and yet there's no consequence for, I mean, think about that amount. Obviously that amount was meant to sell. It wasn't for personal use, because that would kill that person. So it becomes difficult. I'm going to throw the next question out to Cindy, because I know that her staff has thousands of contacts a day on our state highways. And so COVID-19 impacted most of our non-party calls for service and shift towards non-direct contact with public. How has this changed your enforcement model? So specifically, how are your officers doing no contact traffic stops every day?
Yeah, we're not. We're still having to do contact traffic stops, which has been problematic in a sense that people don't want to be stopped because they don't want to have that face-to-face interaction with somebody who they don't know, obviously. And two, it's been such a weird time, because that's our number one complaint that we're getting on the phone from the public is, your officers stopped me, and at the beginning is they weren't wearing a mask. And so it was trying to, allay the fears of the public and also maintain the safety for our officers. And it has, as far as the highway patrol, we didn't really change the way we do business. We did see a big increase in high speeds on our freeways and highways because they're open, because people weren't going to work. So, and we also saw uptick in our fatal traffic collisions locally here. We have had 5 in the Santa Barbara area where I work locally since March 14th. And 3 of the 5 have been DUI related. Is the primary collision factor was DUI. One was under the influence of meth, one was under the influence of cannabis, and one was under the influence of alcohol. The other 2 were still pending toxicology reports. So it's had a huge impact because of the open roadways, the high speeds, and people's coping mechanisms due to COVID-19. Unfortunately, they're drinking alcohol, using drugs, and doing things that are very detrimental to their safety and health. So it has been an interesting time, to say the least. My officers are at traffic collision scenes, and people are not wanting to come near them and to give them any information. So it's a weird time. It really is a weird time.
Have they adjusted well to wearing the masks and gloves during traffic stops, or is that still a challenge for you?
My officers have adjusted well. Due to being a state agency, we're still following the state regulations, so it's not mandated that they wear them. So I have officers who do wear them all the time and officers who don't wear them all the time. So that's where the kind of conundrum comes in for everybody. So it's basically what they feel comfortable with. Now, locally in Santa Barbara County, they've mandated masks in public places. So anytime they go into a public place, they are now required to wear a mask, which they do. So yeah, it kind of makes it tricky for us as a state agency.
Sure. That leads me into my next question. I'm going to throw this one out to Matt. So Matt, how have you been able to communicate to your troops the changing health orders, because they change on a regular basis, and effectively get them to understand the changes? So for example, now we're opening restaurants where you have to wear a mask into the restaurant, but when you're sitting at the table, you don't have to wear a mask, but you can only sit at the table with your family unless you want to sit at the table with somebody else, then it's okay. So you see the confusing, how are you keeping your folks up on all the changes and keeping them up to speed?
So first of all, we got to get the order from the state or the county health officer, hopefully during business hours and not at midnight on a Saturday morning, or at 5 minutes to 5 before getting ready to go home on a Friday. And that's been happening on a regular basis. So the health orders and the state orders have been changing so frequently. It's very difficult to stay up on top of that task of getting information to your people and to the public, because you got to hit both sides. What we've done is, I got to say, we're probably on version 15, is publish on a regular basis changes as they come out to our standard operating procedures related to COVID-19. It's one document, and it's about 7 pages long now, and it has everything from wearing face coverings to what you're going to do if you feel sick, or how you're going to take your temperature coming in the station. As those change throughout the day or throughout the week, we update those, and we redline out what is being taken off the document, and then we blue line it for any new changes that we put it in there, so people don't have to read the entire document over. It's still the same document, but they can go right to the specific information that has come forward with a change. But we publish it as every media that we have throughout the station. But the most effective way of disseminating it to your troops is to get out in front of it and go out in the station and walk around and have those conversations with your personnel. Face-to-face communication with your people, telling them exactly what it means, what it doesn't mean, how it impacts you, how it impacts the organization, and how it's going to impact the public. The problems that you see with it, and the issues that are going to come down as this makes it out into the public. So you try and give them the most information directly from the guy in the front, or the captains, the lieutenants, the sergeants. You just have to get out in front of it. You got to be able to speak it. On the public side, we've collaborated very effectively with our city manager's office, our press information officer, all the other departments throughout the city. We try and publish any change that comes through to every single one of the departments. We make sure that everybody has the same information that we're working off of. If there's something new that comes out from the state, we get that out to the public as early as possible in a clear format that is in the Fountain Valley way. We put it on the Fountain Valley's letterhead, and we use the same language from the state and make sure it's not different than what they're putting out, but we also tailor it to the residents of Fountain Valley. We want them to have as much information as possible and a direct source to go to, where they don't have to go to the state website if they don't want to. They can go to the city of Fountain Valley, and every one of the links is there, and every one of our informational sources is put out. On top of that, what we've done with our call takers is given them a fact sheet with questions and answers that are typically, or the questions that are typically coming in, and give them the answers to those questions. And we forward that out to every one of our call takers throughout the city. So after 5 o'clock, the city goes home, but who's here? Dispatch is here. Those phone calls are still going to come in, and they're going to come to the police department. So I want the police dispatcher to be providing the same information that the information officer is providing over at City Hall, the same information that the water department is putting out. So across the board, everything is consistent, and that there's no difference in our message that we're pushing out to the public.
So one of the challenges that, and it's not necessarily a challenge, it's just a reality. Each county in the state has a sheriff who's an elected official. And the sheriff's enforcement paradigm may not be the same as an individual police departments in that sheriff's jurisdiction or county. And I know that the Orange County Sheriff has been vocal on his position. How has it been really mirroring that with your city's enforcement philosophy? I'm not saying they're different, but has it been just understanding that challenge out there in the public? How has that created any confusion in your community about how you guys are enforcing the health order, or how have you managed that?
Neil, I think it gets confusing when the public calls in, because they're already confused. They're hearing one thing from the county, they're hearing one thing from the state, and they call and we tell them something different. So yeah, people are already confused. But we use that education base and try and let people understand what the order means, why it's in effect, and how we're going to mitigate through it. What is it supposed to do? And we routinely, I get on the video all the time, and I'm put in front of the mic all the time. And everybody always asks me, "What are you going to do? You know, when somebody is violating this order, what are you going to do?" And I tell them over and over again, I'm going to handle it through education. I'm going to make sure that that person understands what that policy, that new directive means. And if they don't understand, we continue to educate them. And as a last resort, that enforcement method is there. And I follow it up with, we're very fortunate that we have not had to use any type of enforcement in the city of Fountain Valley, because our education campaign has been very successful.
So I point that out not because any philosophy is right or wrong. I'm just saying you have the state saying one thing, a county saying another, and a city may be saying another. So that makes it more difficult for that interaction between our officers and deputies and the public, just because of the mixed messages that are coming out. And it's not right or wrong. It's just a fact of life that they have to deal with. So I'm going to throw this one to Kevin. What have you seen is the most effective for employee wellness? What's something that you're practicing to foster that employee wellness?
Well, organizationally, it's challenging because you have the disconnect. People are not, at least for upstairs, our administrative and our investigative staff are telecommuting. But we have our sergeants make sure to get together with their respective units at least once a week, and then check in with them, either Teams meetings or things like that on a routine basis. The messaging coming out from our city, as Matt alluded to, we also have a very good relationship with our city communications, and they're very much about pushing out just people wellness. And then our department follows it up with, we have Cortico subscription, and we have also had our peer support push out positive messaging, provide proactively different messages for folks, access to how to cope during these different times. And so we have some folks that have just stepped up and taken upon themselves to make sure that we're pushing that. And at least on a weekly basis, something goes out reminding people to take care of themselves, take care of their families, and to kind of separate themselves as they recognize the folks they're dealing with on the street are equally frustrated, equally stressed. And that's going to manifest itself, like you alluded to, when you're dealing with people in face masks, you lose a lot of that ability to kind of communicate, put each other at ease. When you see a uniform and basically eyes, it makes it even more challenging for our folks, especially in light, as Matt alluded to, the state says one thing, the feds say another, county says one, and there's all this talk about we may do this, we may do that, and it's not really definitive until usually Wednesday, Thursday, and then it goes into effect on Friday, or you hear about it Monday and it goes into effect on Wednesday. So it's been very challenging. I can speak for myself, it's difficult because we've transitioned to more of a telecommute. And so I'm very disconnected from my people. We did that to try to keep people healthy, keep separation and to have some folks in reserve in the event that the pandemic spread worse and it was a greater impact on our resources down here. But it still makes it difficult to have that face-to-face, and you have to put more effort into following up with your folks and making a connection, because you don't just run into them. You can't stop by and see them at their desk. We have different units working at home most of the time and then going out and doing extra patrol. And then myself and my partner lieutenant staff the station so that we have a manager here. So it's tremendously disconnected compared to what we're used to. So it takes a lot of proactive measures to make sure you're seeing your people and taking care of them and making sure that they're taking care of themselves.
Yeah, it's challenging. So Carol, I noticed we're coming up on time. Do we have any questions from any of the callers?
We do not have any questions from the callers. Maybe we can close out with our, where do you see this going and what's coming down the pipe?
So let's do that in a second. I just wanted to ask anybody, how has their staff been affected on a personal level by COVID-19? Has anybody had positive staff, and how has that affected? How have you handled that, I guess? And that's a question for the whole panel.
I'll start out. I have not had a positive law enforcement staff member. I did have a volunteer that tested positive after they came back from a cruise, and they never made it into the station. And fortunately, that individual has now recovered from it. But it was education for all of us, and it hit early on in the pandemic for us, and it forced us to really think about what we were doing and how we were keeping our people safe. Because if that would have come into our station, it could have wiped us out. It could have wiped out my entire RSVP group if they would have continued with their regular meetings, because that 40 people of 65 plus individuals sitting in a small room, that would have gone through them like wildfire. And we're fortunate that she's recovered, doing very well, but we learned a lot from it.
Great. Cindy? Cindy, any positives?
So far, we too have not had anyone.
Gotcha.
So far, we have not
Cindy, you went digital on us.
had anyone test positive in our command. Employees throughout the state test positive. Oh no! Can you hear me?
Now we got you.
Can you hear me now?
Now we got you.
Okay. So locally at my command, I've not had anybody test positive, thank God. Statewide, we have had employees test positive, and luckily they've all recovered. So we've had an impact to our operations statewide, but nothing locally. So.
Right. So this is a modern day Zoom challenge. All right, we got most of that, Cindy, but we're having trouble with your bandwidth. I'll speak for our department. We're doing antibody testing for all of our sworn staff. We've had 3 people test positive for COVID antibodies. Those 3 individuals were then given the nasal swab, and they all tested negative. So that just goes to show you, at some point, they were exposed. We don't know how, when, or why. They were asymptomatic, and they're no longer they no longer have the virus because they tested negative after the nasal swab. But it just goes to show you that we still have a lot to learn about how this spread through the community and what the actual effects are, because 97% of our staff so far has tested negative for any antibodies, and they've been around these other individuals. So it'll be interesting to see how that plays out in the long run. So let's finish it off with the question Carol talked about. What do you think are the upcoming challenges for us with COVID, and what's next? And Matt, why don't you lead it off?
Oh, what's next for COVID? It's just reestablishing that connection with the community and making sure that you're moving in a positive direction. What does it mean for the priority 2 calls that we essentially stopped face-to-face communication with the public and handling them through electronic media sources? We learned a lot from that. Are we going to still do some of that after we get through this emergency period, the epidemic? Very possible, because we learned another way that the business is operational and doing work as it comes in is more efficient. With the body-worn camera system, there's a bunch of different sources to bring in evidence, to bring in photos and videos from the public, and we're going to start utilizing that on a frequent basis, just because it's a no-touch operation, and it's more convenient for the individuals to be able to do that from their own home, and not to come into the station to have to send somebody an updated video or a document that they discovered that needed to go along with the case. So as we continue to move through this pandemic and learn from it, some of those new policies and procedures that we put in place are going to be here to stay.
Yeah, I think that's a really good point. I think that's true for society at large. It's not just our business, but I think we've learned that there are other ways to do things, and that's what makes us keep moving forward. Otherwise, we'd still be going to call boxes to get our calls for service, right? So thanks, Kevin. What about you?
I think some of the challenges, everything Matt mentioned, I think two of the challenges I see are for us organizationally, because we're facing it. How do we maintain social distancing in the workplace, and what changes are going to have an impact on our various divisions that, like right now, we kind of work in pods, and we really can't be doing that down the road. Secondly, looking at what's the judicial system going to look like. We've talked about the zero bail right now, but how long, and do we have a say in how long that'll continue? What are the consequences? And then in the middle of that argument, or at least in the middle of that issue, you've got the governor talking about closing 2 other prisons. So it's going to, I think, reshape what we can do and what enforcement gets done. And I don't know when that's going to vet out, but I think that's going to be an ongoing challenge for us over the next couple of years as well.
Yeah, that's a really good point. What are our work places going to look like in the future? I mean, if you look at the recommendations that came out for schools for the fall, I mean, it's how much of that gets actually implemented will remain to be seen, but I think our workplaces are going to definitely look different. And, you know, everything from where your desk is to maybe locker room spacing, or, you know, do you space them out based on the shift coming in and all around the locker room so that everybody's not next to each other? I mean, there's all sorts of consequences to this, and we'll have to see how it works out for us. But those are really good points. Cindy, I don't know if your audio's back up, but if you want to give it a shot.
Hopefully I'm here. Can you hear me?
Yep, we can hear you.
Okay, so I think for us, as you all know, the may reach $1 billion deficit. So I think we're going to be looking at, again, doing ways more fiscally responsibly, which we already have been, but we're going to be looking at, again, doing more with less as far as law enforcement goes across the state. So just looking at that, the one silver lining through all of this, which I'm sure you all have felt, is the savings in court overtime. We have not spent any. So maybe virtual court, I don't know, for the future. That could be a possibility. So,
it could
but
be.
that has been one area where we have not spent any money. So
that's also a really good point. Yeah, that could change on a go-forward basis too. I mean, we don't know. We'll have to wait and see how these things play out. Hey, I just wanted to say thank you to the panel for their time, and ask one last time if there's any questions that we can answer from the callers. If not, then I'll send it back to Carol to wrap it up. I think Dave's waving his hand, Carol.
Oh, he's saying goodbye. No, again, and I want to thank you guys as well. I think that the one thing we've learned from the CPOA side of things is that it's these conversations that people are hungry for, and sharing this information. So very appreciative that you and the other panelists and as our CPOA board decided to participate in this. And I would just encourage anybody to let me know. You can send me an email or the organization an email, but if there are topics that you find to be worthy of discussion, especially during these times, let us know, because it's very easy organize something like this. So thank you, and everybody stay safe, and have a great weekend.
Thanks again for
Thanks,
joining the
Carol.
call.